Can you hear me? Check. You can? Thanks so much for the opportunity. Someone at the beginning of the year told me, be charitable with your money, not your time. So thank you for choosing us over everything else. The topic is called wellness and technology, a very powerful combination in my mind, simply because of what's happening in the technology space and how it's galloping, how wellness is galloping in the organization space. So I was doing some research. I don't know if okay. I was doing some research, and I found that there are awesome wearable technologies across the world. I saw something which was a sock which helped your running form. I saw something which was a wearable headband which looked at depression and which could solve depression. I saw something that was looking at supporting drug abuse. These are the various things that are happening in the world, and I have two rock star panelists to talk about both wellness and technology put together. So I have my first panelist. Please put your hands together for Amit Munjal. Amit is a spirited entrepreneur, has traveled 60 countries. I'm completely envious. I'm not even halfway there. He wears an Apple Watch. Healthy habit, I mean, all the stuff that's there, 7,000 steps, and he would have liked to take the entrepreneur plunge much earlier. My second panelist is, I've got the wrong slide, I think, is Mr. Manasije. Please, I'd like to invite you, Mr. Manasije. Sorry about the slide. I think the slide's not updated. Manasije is the CEO of WeHealth. He's played leadership roles in Max Bupa. He's played leadership roles in HSBC, a legend. His role model is Jeff Bezos. He does about 8,000 steps a day. And his advice to his 25-year-old self is, don't put on weight. It's harder to lose. So I just wanted to kind of throw some data at you. That's some staggering data. The market is about 180 billion. The market is growing at 13.4%, close to 14%. There are about 325,000 apps in the world right now. And of course, the adoption rate of health apps is at about 52% over the last 2 to 3 years. So what's happening to wellness in the organization? We started with good to have, nice to have, based on health costs, to now organizations like us and everywhere else are talking about how it's a strategic advantage. So we will start talking about this a lot more. So thank you, gentlemen, for being here and spending time with us. I'm going to do a quick rapid-fire round to warm up, and then because the hall seems half full, so we'll try and see if we can get more people by asking you some interesting questions.
Sure.
So how many steps today?
I will say today would be slightly more than my average, around 9,000 so far.
Nice,
so
nice.
I would be probably covering like 13,000 odd steps.
Oh,
a
nice.
lot of running around here.
Manasije, what about you?
Only 2,000 today.
Oh, okay. That's because you drove from Delhi to Gurgaon. Yeah. Cool. So what's that one health habit that you don't miss at all?
I like to go to the gym 3 to 4 times a week.
Okay.
And then at the beginning of the day, I do my health consultation with a dietitian on Dr. Insta platform.
Okay.
To set the tone right for the day as to what to eat, what not to eat.
Okay.
I also set my reminders to remind me as to, if I haven't stood up enough in a given day, or I haven't taken as many glasses of water as I want to. So all these habit formation, well-being habits that I like to follow in any given day.
Okay. What about you, Manasije?
Well, I like to go for walks. I like to take my team out, whether they like it or not, for a walk after lunch.
Okay.
That's one of the things I encourage. So that all good for the team, good for working on some of the lunch we've had.
Are you shedding weight?
Well, my dietitian
You
is
don't have to
most
answer that.
disappointed. No. I try and avoid her calls. I have a very aggressive dietitian in my operation. And I've been avoiding her the last 2 months because she's put me on this sort of fairly aggressive diet, which I'm finding terribly hard to follow.
Wow. So is that what keeps you up at night? Or
No,
something
I'm not that stressed. No, I think you know I think it's exciting for me being relatively new to healthcare.
Okay.
And I think I find it bizarre coming from a BFSI background, the way the economics of healthcare works. And typically, the strange thing is that a lot of healthcare players make more money the sicker they make you. And it seems bizarre if a car company did that. And the worst car they sold you, and the more it went to the garage, the more money they made. It would be a bizarre situation, and you wouldn't accept it in any other industry.
It's inversely proportional.
It's totally bizarre. The economic incentives for a fee-for-service model that we have in the US, in India, and many other countries is truly bizarre, and I find it fascinating that this could survive for so long.
Nice. So what would you, if you want a CEO, what would you be?
I'd be a photographer.
Sweet. What about you?
If I were not a CEO, I would be a wanderluster traveling the world at all the unique places across the Arctic and to Antarctica all the way down south.
I mean, like I said, I'm always envious about people who can travel a lot more. So, so we've grown up as talking about this adage health as well. You guys have actually made this a business model. Dr. Insta, vHealth. If you can quickly take us through your flagship programs.
Sure.
And then we'll take it on from there.
Definitely. So Dr. Insta is India's leading virtual health player, whereby all the users can have consults with over 40 specialists listed on the app. You can do these consults any time of the day or the night, according to your preferences. You can choose or cherry pick the doctors. All the doctors on the platform are curated by us, so they have to have a specialist degree, multiple years of experience before they could be onboarded. The second feature of Dr. Insta is you can see your own doctor. So let's say if someone is going to Dr. Kumar for the past many years and want to do video, phone, or chat consult with the same Dr. Kumar, you can do it on Dr. Insta platform. Along with that, we have like whole laundry list of features ranging from ordering medicines at a deep discount to ordering diagnostic tests, to doing health risk assessment tests, to electronic patient records management, all on one app. Currently, we have around 2 million users. Many of them are employees in large companies. So large companies onboard Dr. Insta platform for all their employees and the dependent of employees. So all these employees and their respective dependents can now have consultations free of cost, and the employer takes care of the cost structure for Dr. Insta. And this way, all these employees and their dependents can keep the doctors in their pocket. And what is in it for the HR, and I understand many of you are in HR, is that you would see it as a great way to increase productivity and drastically reduce absenteeism, both active absenteeism as well as, passive absenteeism in the organization, besides increasing the productivity of the employee force. So these are the three things that we bring to the table for the HR, not just in India, but all over the world. Those are the unique selling propositions for virtual healthcare platforms like Dr. Insta.
Do you have a booth outside?
Yes, we do.
So folks, you know where to go.
616 is the booth number. Feel free to swing by.
Manasije, what about vHealth? I've heard that you've transformed the whole vHealth brand inside the company. So would you want to talk about it quickly?
Yeah, let me tell you the story of a Mr. Kumar. So Mr. Kumar worked for a responsible corporate, and this responsible corporate had organized some basic preventive health checkup and also a health risk assessment. And one of the things that came up for Mr. Kumar was that he got flagged off into our sort of habit cessation program, and so he came out as a part of a high-risk cohort. So that's one of the things we do. And Mr. Kumar fortunately took this a little bit seriously, and he set up a consultation with one of our vHealth doctors. And Mr. Kumar was chatting. His blood report were actually fine. He was a man of 50, a little bit overweight, lipid profile was slightly off, but reasonably healthy. In India, we would consider that to be extremely healthy. But he had one problem, and he said, I've got this little boil on my tongue, which is not going away. and it's preventing me from really enjoying my food. And he's got no other health problem. And he hadn't bothered to really consult anybody about it. But for some reason, he also said that, I'm also getting these terrible stomach upsets. And, my main problem is I have this acidity problem all the time. And then as we probed further, and that's what our doctors tend to do, we have long consults, half an hour, 15 minutes, 20 minutes, half an hour is a typical consult for us. Realized that the gentleman was self-medicating. He had put himself on a course of antibiotics to treat this boil which was bothering him. And he had been eating these antibiotics for a month. And so our doctor said, look, you've got this problem. You can't sort of eat these antibiotics for a month. It's obviously affecting your stomach. So, simple probiotics to fix that. But more importantly, he also discussed with the doctor that he had a history of chewing tobacco. And we got a bit worried, given his lifestyle questionnaire, given the fact this boil was persistent. We sent him to one of our ENT specialists with a recommendation to do a biopsy. Turned out to be malignant. Turned out that he had early signs of mouth cancer. We then were able to send him to an oncologist on our panel, who then treated him. Our home healthcare partner provided chemotherapy at home, so he could have it relatively comfortably at home. And he was back at work, productive as usual. This didn't bother him too much. And he was very grateful to his company that because of the program the company ran, this was diagnosed so early.
Wow.
And I think it's a great story. And we've got some great patient stories about how bringing together the various elements of primary health care, just putting all the, joining all the dots, whether it's the specialist care, whether it's doing a basic health risk assessment, and something quite simple can lead to a fairly important event in somebody's life. And when he turns around and looks, says, my company is fantastic. If I hadn't participated in this company's program, these HR folks, they got me to do this health risk assessment, and look what it did for me.
Okay.
I think that's what we do, and I think it's about avoiding serious interventions. It's about early detection. It's about managing stuff in the primary care. I fundamentally believe that if the primary care part of our health system is taken more seriously, we will have amazing clinical outcomes. Unfortunately, we spend all our money and attention on
reactive,
on tertiary care, on secondary care, which is highly reactive.
Indeed.
So what's the impact of BeHealth right now? I mean, the number of footfalls.
No, so we have 1 million customers already.
Okay.
We've been at it for about 18 months.
Okay.
We have an ecosystem of about 16,500 clinical partners. We are able to do an overnight blood test in 500 cities. We're able to get your medication within 4 hours in 300 cities. So we've built a very neat ecosystem.
Okay.
But ultimately that ecosystem is at the service of the individual. And it's about that the human doctor actually spending time following scientific clinical protocols. We are the global pilot site for Aetna. So we tied up with a Swiss company. We looked all over the world to see who does this well.
Okay.
We found a Swiss company who had been at this for about 15 years.
Okay.
We got their clinical protocols. We send our doctors for training there. So we've really invested a lot of money in the clinical excellence of our telemedicine. And that's what we're really proud of.
Actually, a lot more people should know about this because it's important to kind of identify things earlier and then go after it. So as HR organizations, we actually dabble with a lot of these things, more reactive than proactive. I mean, obviously we're moving towards in that direction. But what do you think is possibly the one wellness trend that organizations should possibly start embracing, and how do we go forward with it? Because as HR folks, we are sometimes we read this information on websites and things like that and make decisions not going by experts really. So what do you think should be, what should HR be doing?
I think it's really focusing on primary care, because HR today tends to focus only on tertiary care. And the health insurance that we all provide, and all our companies do that, is really a reactive part of the wellness chain. And it's about taking primary care more seriously. I think it'll make a huge difference. And I believe fundamentally, especially with my insurance background, over 2 to 3 years, you will see significant cost savings as well. But also from just the employee tax point of view. Today we used to have this 15,000 domiciliary benefit, which is now gone. It's got merged into something else, right? So instead of just putting 15,000 bucks into the taxable income of the employee, even if you take 5,000 rupees out of that, invest in primary care. I think you'll see a huge difference in the peace of mind, the family, and a lot of people will participate. Fortunately, very few people have to go to hospital. But every family has to have some form of primary care. And if HR intervenes at that level, I think that, to me, that's the fundamental difference that we can make.
Perfect. What about
And
you?
I would like to add, along with primary care, definitely no-brainer there, we should have primary care. Along with primary care, preventive care. And when we look at our country, and we ask so many employees that why do you kick the can down the road? Why don't you go to the doctor at the first sign of discomfort or issue, whether it is a physical issue or a mental health issue? They say that, oh, it takes 3 hours of time for me to go consult a doctor. I have to waste so much time dealing with the parking ordeals, dealing with the back-to-back, bumper-to-bumper traffic in the city, and then, dealing with waiting in the waiting room of the doctor. And in cities, if you look at India, many of us have very busy lives. We, as well as our, life partners, both work. We have dependent parents, and many of us have dependent children as well. So life is very, very busy, juggling multiple balls in the air, as a result of which we ignore the first signs of discomfort, whether it is physical health or mental health, by not seeing a doctor. So with virtual healthcare platforms, the beauty is that you don't have to kick the can down the road. You can just tap the app and the doctor appears in front of you and asks you, hey, what kind of issues are you grappling with? And you would get immediate response to the issue that you're dealing with. And in cases you have to go to a clinic, these doctors are very well capable of letting you know that, hey, listen, you are in small minority of the cases where you should go to a clinic or a hospital and get yourself checked. Although vast majority of OPD, outpatient department consultations, could very well be resolved on platforms like Dr. Insta, but still in small minority of cases where you have to go, these doctors would tell you to go. Otherwise, your prescription would also come electronically to you. Not just that, in India especially, there's a huge social stigma around certain practice areas like psychology and sexology. People don't want to be seen at those clinics because they feel that their reputation would get tarnished. Now, psychology has a very, very broad base because, they say every individual in their respective life journeys has been impacted by it or is going to be impacted by it with issues like anxiety, stress, depression, relationship issues, conflict issues, grief and death-related issues. So why to jeopardize your mental health? You can seek the help from a psychologist or a psychiatrist and get that taken care of. The ground reality today is that, many a times people either ignore these issues or go to a neighborhood chemist store or pharmacy store and ask the guy there, who they know in their subconscious is not even well qualified to give you the medicines, yet we ask them, hey, what should I take? And we become the guinea pig of this bhaiya at the chemist store, taking the strongest of the antibiotics, which have their own side effects and long-term resistance-related bad effects on our bodies. So we don't have to deal with any of this anymore, just like most developed countries, as well as many progressive developing countries like China. Now all these doctors are accessible to you as and when you want, thanks to your employer, or even in B2C format as well. So I would say, one should take, primary control of their health and focus more, as my friend Manasije said, on primary care and preventive care.
I mean, easier said than done, but
easier said than done.
So in the interest of time, I want to just open this to the audience. How many wearables in the house? How many wearables in the house? Yeah, as in how many wearables do you, health wearables that you wear?
How many people are wearing
How many
wearables?
people? Not that many?
There are some in the back.
How many health apps?
They were walking around in lunch break, so that's
I thought HR leads by example. So I'm going to open this up to the audience. If you have any questions to the panel, please leverage it, and then we'll take it on from there. Go ahead.
On the data privacy, because we are talking about a lot of information now these days, especially with the wellness and about the employees. So what do we do about the privacy, when it comes to?
Sure. So all these, I can speak about Dr. Insta. We take data privacy as the front, center, and back of the company. So data is 100% private, encrypted on the Dr. Insta platform. We use the best of the cloud service out there to protect and encrypt the data, which is hosted on the cloud encrypted cloud by the patients. And it's not accessible to everyone, even within the organization. Even the data or the quant engineers at Dr. Insta, many of them would not have access to this customer data on the platform. So we have this system called EPRM, Electronic Patient Records Management, where patients can save all kinds of confidential medical data, from X-rays to CT scans to prescriptions to MRIs to you name it. And now when they're consulting with the doctor, they can press the button, which doctor do they want to share this data with? And only when they give the approval on the app is that doctor whom they are going to consult with or are consulting with already, would this doctor be able to access and review the data. So data privacy is super critical, we believe, because at the end of the day, it's health related, it's individualistic, and only the person about whom the data is and who is the owner of the data should have access to it.
Well, sure. Nanjappa, I'm sorry to interrupt, but that's all the time that we have right now. In fact, we're over time by a couple of minutes. So I just request you to wrap.
Cool. You can catch the panelists outside. They're really legends at their own game. I just remembered a quote from a great hockey player. He said, "Great players play where the good players play where the puck is. Great players play where the puck is going to be." So that's where these great players are going to be. Please visit the hubs outside, if the stalls. From an HR point of view, all I want to say is it's very important to go the preventive way than any other. Organizations, I've been part of a wellness program for about 15 to 18 years now. Technology plays a huge role in segmenting and personalizing the experience. I wanted to show a picture of what we do. Sorry for the guffaw. But what we've tried to do at Infosys is segment the population, use technology, personalize the experience, and our footfalls have gone from 10% to over 50%. And it's been a huge customer feedback and satisfaction around it. So that's really what we have from this side. Please feel free to catch up with the panelists after we go. Thank you so much.
Sure.
Thank you so much. What a fantastic, very engaging panel.
Thank you, everyone.
Thank you so much.
Thank you very much. Thank you, gentlemen.